Hi, I'm Rick Larsen, and I created this short video presentation today to talk a little bit about healthcare reform. As elected, I decided I was going to focus on economic recovery. We have to get people back to work. That's my #1 priority. My friends and colleagues in Congress have a different agenda. We want to spend all of our time right now trying to repeal the healthcare reform bill. And if we repeal that, it's going to have an extremely negative impact on a lot of people in Washington State and our neighborhoods. The first thing I want to let you know, though, is that the nonpartisan Congressional Budget Office has said that repealing healthcare reform will actually add $230 billion to the national debt between now and 2021. That's not debt that we can afford, and that's one good reason why we should not repeal healthcare reform. Now I want to outline 3 critical areas that are 3 critical problems that will have a negative impact on the people in Washington State if healthcare is repealed. So one part of the healthcare law actually allows parents now to include their children who are up to the age of 26 on their insurance plan. The law previously limited that age to 23. And what that has meant is that over 20,000 young adults in Washington State are now eligible to move on to their parents' insurance plan. And if you repeal that provision, those 20,000 young adults, including young adults, the students who are at Western Washington University in Bellingham in my district, if you repeal that provision, what that means is that 20,000 young adults will lose their health insurance coverage. That's one reason why we should not repeal, and another reason why we should continue to move forward and implement healthcare reform. Another negative impact of healthcare repeal is on our seniors. The healthcare law that we passed gave seniors help in the gap in coverage for their prescription drugs that they get in Medicare. Seniors know this as the donut hole. And in Washington State, 45,000 seniors are getting help to close the donut hole over the next 10 years. That is great news for them. But if we repeal health care, those 45,000 seniors who are out of the donut hole will be sent back into the donut hole, paying hundreds of dollars a year, again out of their own pocket, for their prescription drug coverage, making it much more likely they're going to choose between paying rent or paying for their necessary prescription drugs. Well, finally, there's one more issue I want to talk to you about. The passage of the healthcare reform law allowed parents who had kids with pre-existing conditions to bring those kids onto the parents' healthcare plan. Now, this has been a positive impact for a lot of people in our area. I talked to one woman in Arlington, Washington, who has a daughter with pre-existing conditions, and because we passed the healthcare reform law, she was able to bring her daughter onto her healthcare plan, and it saves the family $10,000 a year out of pocket. That's real money to that family. These are the reasons why we need to implement and adjust the healthcare reform law. We can make changes as we go forward, but there's been a positive impact for moms and dads, for seniors, for young adults who are now able to get insurance. But I encourage you to go online to larsen.house.gov, send me an email about your thoughts about healthcare reform. I'd be very interested in what you have to say about what we're doing here in Congress with regards to healthcare. Thanks a lot.